All right, Dr. Wong.
This is a procedure called microneedling with PRP, standing for plasma-rich platelets, and our patient here, I already did half of her face, so we're going to use the microchanneling device that we have here, and making little channels that go into the dermis of the skin. The depth can be controlled by the length of the needle. The needle that we've chosen is 1 millimeter. Let me just show you that. So it's 1 millimeter in length, creating the depth of the channel. It comes in various sizes, 0.25, which is basically the surface of the epidermis, all the way down to 2.5 millimeters. So we'll reach the dermis layer. So with this procedure, we'll already had prepped the patient here, and we're going to make the channels here. And with this device is very simple. It's like stamping, a stamp per se.
What is that in your hand, Dr. Wong? The other needle thing?
The other needle is the patient's stem cells that we harvested through her blood.
Oh.
So once we make the channels, I'm going to apply her stem cells, and it's going to seep into the dermis layer, where it's going to stimulate her own collagen and elastin, and over time, usually within a month, it will stimulate her own body to make more collagen and more elastin to give her a youthful look. Alright, so let's start over here for a moment. Let's see here again. No pinch. She gets a beautiful reaction by a redness of the erythema, as you see over here, the real red round circle. That's because the needles have penetrated her skin at a depth of 1 millimeter in this case.
I see.
And it's going to, then I'll inject, or I should layer over the area that we created the channels, and it's going to seep right in. So let me just make a little bit here more.
Beautiful.
Look how fast she has become red. That's the reaction you want, because it's bringing all the blood flow to the top. And for certain medical reasons, I'm avoiding her chin, although we usually do her chin. The forehead is usually the toughest because there's not as much skin or fat layer involved. Okay, so once I've opened the channels, now I will saturate the top layer of the skin with her own stem cells, which I had in this needle here, and I've just spread it all across the channels that we created, and it's going to seep right in.
Oh wow!
Now the patient I already did the patient's other side, her right side. This is her left side, and she already noticed a nice difference in her texture of her skin, because I've showed her through a mirror, and she was rather pleased and impressed by this procedure.
Beautiful.
So I'm just applying her stem cells. Now when we create this channeling or microneedling procedure, the channels are open for about 90 minutes. So you have a window of only 90 minutes to apply whatever you want to use as your stimulation of these collagen and elastin. And after that, the channels, like a regular pore, is going to close up. So for tonight, because she could actually apply makeup and moisturizer and everything else after 2 hours, because by that time all the pores would have been closed by now. But technically, we'll see how she does in a month's time, just to get the best lasting effect. So there you go. Now this is one pass. I want to probably do 2 passes on her just to make sure. As you see, she has a lovely red hue bilaterally. Like I said, I'm avoiding her chin at this point, and she's gonna. The prognosis on her is very good. It's excellent. That she's gonna get a really nice result. So this is microneedling or microchanneling with the use of PRP of her own specimen.